And so I actually started working in the field of mental health since I was 15. I just turned 20 this past December. And so it's been about 5 years now. And so the first organization that I ran was when I was a sophomore in high school, all the way up until I was a senior in high school. So 15 to 18, I ran a nonprofit organization that focused on mental health policy change and awareness. My team and I, for the 3 years that we were working, we worked in 2 legislation sessions, passing 1 bill. And gosh, it was a crazy experience, I will say. Like, I look back at it and I'm like, there's no way I passed a bill, but hey, my team and I did it. It's one of those things that you just don't soak in. Like, you're never like, oh yeah, I did that. You're just like, what the heck? But yeah, and so we focused on mental health specific policies. The first bill that we worked on was a suicide prevention bill, specifically around funding for high schools across the state in Washington. Sadly, that bill did not get passed. But the amazing thing that came from that was that we were able to have this beautiful experience working with adults, working in the system to get things, attempting to get things done. I think that was very valuable as a 15-year-old, 16-year-old.
So knowing that you don't really have to struggle alone, that you can make that sort of change with the sort of local representatives that you did mention, that's absolutely amazing.
Yeah, absolutely. I mean, it's so, like, in high school, what really led me into the field of mental health was that I had a psychology project when I was 15 for my sophomore psychology class. Long story short, we had to make a presentation, present the presentation, and it had to be around like kind of raising awareness or, finding a solution to a problem in high school. And I chose like stress and anxiety. And my principal was like, no, your idea is terrible. And the idea was to have a resource hub. So basically kids can know what resources was available for them. And so I was like, okay. And so I went straight to the representatives. I think, you're going to have some pushback sometimes when you're especially talking to adults, but that's why it was amazing to be able to work with, actual representatives in getting something like this passed.
For sure. And
it's a matter of like you said, teenage years are the years where you learn the most. And there is a huge difference when you have an adult that just completely shuts you down and you have an adult that kind of helps you walk through the process. It's a complete different learning process.
Absolutely. And really just centering on that sort of, low GPA means you're not trying, you're not a good student, you're not competent at all. I hate that. Like, as you said, if you work with the students individually and try to help them learn, if you try to help them get through these complex times, it's most likely going to be more effective than just completely being shut down. Because if you think that low GPA students are just these troubled kids, they're going to be more troubled if you're going to just say, no, you're stupid. Go away.
Yeah, and I was really lucky because I graduated high school with a 2.6 GPA, probably like less than 1,100 SAT score. And I go to Cornell University now, which is an Ivy League institution. And so it's a complete, opposite what you would think of for a student going into Cornell or really coming into college. I think when you go into university, it's a lot of, or even graduate high school, it's a lot of self-reflection. And that does kind of come into my personal background of coming from this bicultural household, being half Japanese and half English. I became really aware of how my culture really affected my perspective on mental health. And so while I appreciated policy, I kind of wanted to dive into that research idea of how does culture affect mental health. And so coming into college last year as a freshman, I disbanded my old organization. Like, I had friends that were going to the Navy, friends going to, across the world for colleges. Like, it was not appropriate to bring this out of there. And so I founded my new organization, which is the one I mentioned when I introduced myself. And it's kind of really just based around having young leaders do global research around mental health and kind of showing people that we're not here to help you, we're here to listen. I will not say I have the next best solution. I won't go interview someone from another country and say, let me tell you what you need to do to fix yourself. It's kind of like learning to sit back and learn from them and listen to them and falls under this medical anthropology. It's learning about people's kind of like cultural medicine in a way. Their spiritual ways that they treat depression or things like schizophrenia. Like, you see totally different medical practices in treating mental health or addressing mental health. And so there's been a lot of medical anthropology touching into my work, which is super exciting. I'm loving it.
I love that. I always just thought of people actually, I watched this whole documentary about this woman who is an anthropologist I really don't remember the documentary. I wish I could tell you so you could watch it because it's amazing. But it was trees and just trying to learn about their cultures in order to effectively combat climate change and everything like that, and their sort of ways of doing it. And even though she was not directly, again, instructing them on what to do, she was taking these tips and gathering these tips in order to find like this holistic way to combat climate change. And that's pretty much how I see your research from that sort of perspective. I love it. I think learning to listen, like as I said, that sort of understanding that everybody processes things differently can lead to empathy, but also learning to listen and really process that as well. Something that I struggle with, not gonna lie, when it comes to just like, this is why I always tell people I would be horrible at debate. Like I honestly like admire people that are in debate class, because I'm the type of person that's just like, yes, I have this standpoint and I see flaws in your argument and they're wrong, but I don't know how to explain why they're wrong because this is my argument. So
exactly. Yeah.
So,
yeah. I think when I was in high school, I was this very ambitious, stubborn 15-year-old that, saw a problem that was going on and I wanted to see things, get better. And so I would demand change. And I think it's good, especially at a young age, let's say if you're in high school, especially, utilize your youth in the terms of like being able, you're still really young, but you're still really intelligent. You're able to use your youth as a way to help others. And I think that is beautiful. But I've learned the most about both the hard stories and the great stories is that they're both equal. I think it's beautiful because all these stories that I'm hearing from people, that their perspectives. There's this girl I interviewed and she was telling me about the hardships in her family life and losing basically everyone in her family and having to move to another country. But she told, this really, saddest story with a smile on her face, laughing throughout it. And you could just like, that is so beautiful. She wasn't saying that she was happy because of her situation. She was saying that there's still love in the world. She was saying that there's still good things. And that is what she's going to look at over than looking at all the bad things too. So I think, it's both a slap in the face and it's also like really like, wow, like there's people out in this world that really struggle. And in these interviews, there's not much I can do to help them. There's not much. I'm just sitting, in front of a computer, with someone across the world. Like there's not much I can do as a 20-year-old, 19-year-old at the time. But what I can do is just give them the space to talk about it because that doesn't exist everywhere. And I think it's just really encouraging to hear people's story and hear people look at them and realize that they're relieved at the end of it. Is still my community. I think being a mixed culture or bicultural, coming from a bicultural background is difficult sometimes because you want to support both sides of your family, but you don't know how to do it sometimes. And I think that's my biggest struggle when it comes into it. And growing up, obviously, I unconsciously suppressed my Japanese identity, but I am a Japanese American woman doing mental health research. And that's something I'm 100% about, loving. And I think it's kind of like building your own community for me. But it was definitely difficult growing up. I didn't really understand the differences of culture. I just accepted it because that was my normal.
Wow. I think I definitely relate to, like, as I said, I'm very Black and navigating that sort of white community. I definitely relate to that sort of sense of like realizing or not really realizing that you're different until like an older age.
Yeah. I think something that at least 2022, what we're working towards is that we're hoping that these interviews that I'm doing across the world, where I'm like me talking to another person about someone else's culture and vice versa, we're going to try and do small conversation interviews where basically I am training young leaders from different countries to replicate the interviews that I've been doing within their own communities and within their own cultures. And so they can talk to another person that shares their culture and they can have a bigger, more kind of related experience around mental health. And so that's something that we're working towards right now. I have a girl from Tanzania, a guy from India, and another guy from London that is able to kind of help me kind of formulate these conversations. And a girl from Malaysia as well. And I'm very excited to see how these conversations go in more of a local community setting. I'm writing a book, which is exciting. Yeah, I've written like the first manuscript and I'm going back and I'm editing the second. Don't know when that's gonna come out, but one day.